The most important part is these cardiac arrests do not happen in hospital. They do not wait for an ambulance. They do not happen near a doctor or a trainer. It happens suddenly in a public place. And more importantly, the first 3 to 5 minutes of what we do immediately when somebody collapses or cardiac arrest is the difference between life and death. So that's why we thought we should have this initiative to make everybody be aware and do some sort of an effort in trying to save lives. The message we wanted to send is, you need not be a doctor to save life. All of you, by simply knowing 15 minutes proper skill, can make a huge difference in saving lives. Just to think about it, we train people to drive cars, vehicles. We train people on computers. We train people on smartphones. We train people on Macs, languages. Why do we do that? To make them successful. But what is success without a life? So life is one of the most important criteria, or living is one of the most important criteria to be successful. And a simple 15-minute skill, if everybody can make, that would make a huge impact in saving a lot of lives. So this was the initiative behind that. And also of late, we have seen some of our known people, colleagues, suddenly dying, and we always felt if somebody had done the initial BLS at that point, maybe they could have saved their lives. So that was the thought behind that. And then we thought, as a responsible hospital, doctors, nurses, and the medical community, we should be taking this initiative forward to everybody in the public and train them on this, so that over a period of time, everybody can make an effort to save lives, and that will have a huge impact. And this is one of the first initiatives, and this is going to be an ongoing event, and we will try to do it continuously. To create this awareness, we have to do it on a large event, and many of them have volunteered to go through a more process training. One of the key messages I would send is, spread this message, let people know. It takes only 15 minutes to get this trained, and this training can make a meaningful change to somebody's life. Thank you.
Certainly, I feel very proud today that on this 77th in Republic Day, we just thought of an initiative of a recent incident in our hospital, whereby we thought like how we can initiate. We always speak about like health awareness campaigns, bringing proactive health measures, lot of master health checkups, lot of pre-screening activities, and like 4 months back we joined together for launching the MGM Healthcare card, which was one of the initiative again by us. But how much as a society we are prepared for emergencies to happen? So each one of us, any of us can have emergencies at any time. How as a layman people, how as a normal public, are we ready to respond to these emergencies? Of course, we have our hospitals are known to doctors, emergency numbers, we call them. By the time the person arrives, by the time the ambulance arrives, how much are we prepared? So BLS, Basic Life Support Training, as I said, it's 15 minutes for us to understand how do we respond immediately, and yes, a small act by us can save lives, not only of our near and dears, but also at a general public platform. I thank all media people who have joined today to witness this and take this message. I request you to spread this along with us, how we can make people aware to keep health on the top priority, and we'll take this message ahead. I thank all the team members who took participation, volunteers from the hospital, both the clinical and the non-clinical fraternity. Almost around 250 plus people were there on the ground on one day at 77 location. We started at our Vizag hospital at morning 7 o'clock at the beach side, public activity till the dawn at Chennai, and all our 4 units currently participated in this across 77 locations, covering all sections of society, right from a 7-year-old boy to a senior citizen who took participate in this, and this is a kind of awareness we want to take this as a consistent initiative by us. And I don't want to put any number or any target on this, like, okay, how much we'll be able to cover. We want to cover as much as people part of this initiative. Once again, thank you very much to everybody. Thank you.
It is very important to know. I'll tell one example. This was 10 years back. A person was bringing his child to the hospital in an auto rickshaw, and midway child stopped breathing, became unconscious. So that person started chest compressions and brought to the patient to the emergency department, where we did the advanced cardiac life support, and we could get back the heart. And the child woke up. Then we did the corrective surgery, and after 10 years, he came the other day. He has grown up young teenager. So this wouldn't have been possible if the father was not doing the proper chest compression. So in BLS, when there is an emergency, patient is unconscious or anything, you try to maintain the circulation life till the patient is brought to the hospital. You may get back the heart in the hospital, but if the oxygen is not gone to the brain, if the patient is brain dead, no matter whether the heart is functioning or not. So BLS that way, it involves, one is proper chest compression, where exactly to compress the chest, how deep and at what rate. These are all taught the other day. And also how there are some medical equipments in various locations. For example, in railway station, airport, there will be AED, that is automatic external defibrillator, oxygen. So how to make use of those equipments? Everybody should know, because in an emergency we don't know, doctor may not be there, healthcare worker may not be there. So everybody should be taught about the BLS. Now in the last Friday, when it was at 77 locations, probably we would have trained few thousands, but the idea is to create the awareness so that all over the country it has been taught to each and every individual so that they can save lives. Thank you.